Dr. Botox here, Dr. Danielle Marr. I'm Clinical Director of DermaFace MD and presenter of the UK version of Botched 50 Plastic Surgery Shockers. So I had a number of questions this week about smokers' lines, and we went over some basics, and I just wanted to reiterate and circle back as someone asked what to do about smoker lines that were just over the lip. So that's a great question. Thank you so much for that. Firstly, just to recap, the general smoker lines can be static or dynamic. So they can be static, which means they're smoker lines that are present when the face is at rest. Dynamic smoker lines are lines that appear when the lips are pursed, when you would be smoking or some such, or just talking. I have some actually myself. So the difference is static lines present when the face is at rest. So when my face is at rest, I don't really have any lines. When I move and it's dynamic, you can see the wrinkles up here because I need my Botox done. So that's the difference between static and dynamic lines. Now, there are a number of people who can get smokers lines, smokers obviously, also non-smokers, would you believe, and then also people who've smoked and then obviously quit smoking. So they're the different variations that can precede this situation arising. So the very first thing to do is obviously to lock down the vermilion border of the lips, because if you can move it, then it'll get worse. But if you actually have it so that, and I'm not saying you freeze the lips, but if there's a band of filler along here, you can't purse them. You can still speak perfectly, but you can't do that swooshy up sort of face. So if you have filler along the vermilion border, which is where the pink meets the color of your skin, whatever the color of your skin may be, and in my case it's white, so where the pink meets the white, if I have filler along this area here, then I can't really purse my lips too much. I still can, but not as badly. So the first thing is lock this down. So some dermal filler in here, and obviously the product has lidocaine in it most often, at least you would hope. So then you want to be careful that it doesn't plump up the area too much and someone doesn't overfill that area. Also, when I'm injecting, I always inject along here. Well, I go in here and I tend to be able to get it to shoot up. There's a tube along the vermilion border. The same on this side. Obviously, if you have scar tissue in there, you've had a mix of products over the years, or a silicone, God forbid, then it's more tricky. So first of all, lock that down. Almost like the old cowboy movies, like I explained before, you batten down the hatches of the door. So that's a lockdown. So that'll get you 60% good. Then the next thing is, this is the question specific to this video. If you've got smokers lines that go close over the vermilion border, you can actually inject upwards into each of these and just put a little blob, just like a tenth of a 0.1 ml. And again, remember, hyaluronic will attract 1,000 times its weight in water. So again, don't overfill. And by putting a little blob in there, you're placing a little molecule, well, a few molecules that will attract more water and plump it up. The last part of the equation is then to have a quarter Botox here, quarter Botox unit here, quarter Botox, quarter Botox, and you can actually zigzag it along. Make sure you go to a really good injector though for all